Hey guys, and welcome back to the channel. My name is Ari, and hopefully you'll stick around for a quick video. So hey guys, I'm trying to keep this breast augmentation blog going and adding new videos every step of the way, not just for you, but so I have something to look back on as well. So this is going to be one addition in that playlist. So this past Monday, I had my pre-op appointment. Then on Thursday, I had the pre-op physical. So I thought I'd make a little bit of a video telling you kind of what happened during those and what you can expect if you have one of those coming up, or if you are thinking about looking into breast augmentation, what to expect throughout the steps and stages. So you'll have to overlook my super casual look as a side note. I don't normally do videos looking like this because my arms are kind of scrawny and I don't like it on there. But my Lord, it is hot today. So I'm suffocating. I cut off the air conditioning when I record because you can hear the roar in the background. So it's a little warm. But anyway, so about the pre-op appointment. So I had to drive about 2 hours to get to my pre-op appointment. When I got there, thankfully they were able to get me in really quickly. And I can tell you, that appointment was pretty much nothing. I went, the doctor poked his head in the exam room for just a moment to see if I had any questions. And he was very open to answering any questions I had, very friendly. You know, I asked him just to confirm, because we've talked about 375 cc's, and I asked him, you know, just, I know we've talked about it, but do you still feel confident that I can handle 375 cc implants? Which he said he did not see that as being a problem at all. I told him I'd been kind of watching YouTube videos on breast augmentation, to which his response was, oh, don't do that. Then I explained to him that I'm talking about recovery videos because I have not watched the actual surgery, and I'm never ever going to, which I also explained to him. But anyway, so when he got done with that, we went through the paperwork. I had several things I had to sign off on, several agreements. You know, pretty simple things. We talked about the follow-up appointment. Because I am so far away with it being 2 hours, normally they would have you come back 1 week after your surgery to have the stitches taken out, and then you would come back the following week just to check on how things are settling and making sure that you're not having any issues. Because I have such a long trip there, and it's going to be right, you know, after surgery, thankfully, they're going to let me do a 2-week appointment because they said that my stitches are not going to cause any problems. I'm going to have waterproof bandages underneath, and that's it. And I can take a shower 24 hours after surgery if I'm able to, if I feel like it. But from a medical standpoint, I'm allowed to do it. So I don't have all these things I have to wait for. You know, it's just the stitches. And he said 2 weeks was not a problem at all. The only thing I have to remember is the little tape that's over it is the waterproof tape, and I do have to take it off after 1 week. He said it would probably fall off, but just in case it didn't, because he said it sticks pretty good. And if you leave it on too long, then it will it'll be difficult to get off. And you'll end up bruising and causing all sorts of problems on your chest more than what you need to. So that was the big part of that. I signed everything, and then I was gone on my way back home. It took quite a bit longer to drive to the appointment than the appointment actually was. I wasn't rushed or anything. I was given every opportunity to ask any question I wanted. I just kind of already did that in the consultation. And thankfully, my surgeon, I didn't even have to ask that much during the consultation because it was kind of like he and I were on the same wavelength, and he just started giving me the information that directly corresponded to the questions that I had been thinking of. I think I might have asked like 1 or 2 questions, and that was it. So thankfully there was that good connection. He ended that, the pre-op by just saying, okay, well, I will see you, at the surgery center at the hospital when we're getting ready for your surgery if you have any new questions. And of course that's where I have to sit there and he has to draw, everything out on my chest, so with basically Sharpie, so I can scrub that for the next 2 months. But so that's how that appointment went. On Thursday, I had my physical. Now that I was a little bit more nervous about, because, my HRT doctor, I made sure that this was a doctor that specialized in the LGBT community before I went. My surgeon, this is a surgeon who does, breast augmentations for trans women. So very familiar. However, when I'm going to the doctor, that's a different story entirely just for a physical. So I did go for my physical. Basically, I had to go. They asked me, all my medications, my medical history. They checked the whole, can you follow this light? Let me look in your ears, check your throat. Can you put your arms behind your back? Can you put them behind your head? Raise them up in the air and wave them like you just don't care. No. And then they have you, bend your knees and all this and push on your stomach. Everything was fine. The only thing I got critiqued on, which I'll bring up since I am in sleeveless right now, so I know that's probably going to come up. The only thing is I got a public service announcement on anorexia. So let me just clarify for everyone. There are more than a few people in our community, the entire LGBT community, that suffer from eating disorders. And I'm not going to tell you that I don't have many, many problems. I'm sure I do. I deal with depression, anxiety. However, one thing I don't deal with is an eating disorder. I'm actually quite the pig. When I sit down, I eat, I'll order, the extra large pizzas, and that's just for me. And I eat that night. I'm a pig. But I don't put on weight. They've even checked my thyroid to make sure I'm not burning it off, because of, I don't know if it's hyper or hypo. I think it's hyperthyroid. And everything came up fine. So it's just part of my metabolism and how I break things down. I don't get a whole lot of fat, and I'm just a skinny person. If you are a medical provider, I appreciate you looking out for your patients, but please keep in mind that basically accusing someone who has had their entire life being told that they're too skinny or, things like that from people, being accused of anorexia when you're not one is a little bit on the frustrating side, because I get really tired of defending myself on that. But anyway, other than that and a few awkward questions, because I did, and I'm going to do a video on things that medical providers need to know about the trans community, because I did get more than a few questions that had nothing to do with the reason why I was there and just really wasn't pertinent except for someone's curiosity being piqued. And I can appreciate that people want to learn more, and maybe they haven't had the opportunity to talk to someone who is trans, or maybe the thought process hadn't even came into their mind until they're dealing with that first trans patient. So I am going to do a video on things that you need to know about the trans community as a medical provider. I am not a medical provider, but I know what it's like going in and feeling like you have to explain yourself over and over again. So I'll have that coming out later. But overall, it did not go bad. No one was purposefully rude to me at all. The questions were just more than I would have really liked to have answered, but no one was rude. They were all incredibly polite, and it's just a learning curve issue. So anyway, that is how everything went. I do not have any more appointments between now and surgery. Surgery is on the 23rd, and I am super excited to get that done and over with. I will have more videos coming out throughout the time frame, and probably for about 2 weeks after surgery there will be pre-recorded videos that are going to be released as well. So just so you know, if it comes out on the 23rd, the day I'm in surgery, it's probably not a brand new video, because I'm not going to be recording any. I'll be recording, but I won't have time to edit and put things together, because I am going to try to record and document as much of the experience as I can, so that I can show you guys, and also so that I have something to look back on. So anyway, that's kind of what's coming up. Monday is this coming Monday, which I don't know when this is going to get posted, so I want to say that's the 16th, maybe? I don't know. Is my last therapy appointment before surgery, so that'll be fun to get out all my anxiety. But anyway, that's pretty much it for today's video. I really appreciate you watching. If you haven't already clicked the subscribe button, please do. We would love to have you be part of the little community that we're trying to form here. I want your ideas. I want your comments. I want your input on what you would like to see with the channel. So please click that subscribe button on your screen and join us. I'll end with my quote from Kesha. Don't let the bastards get you down. Hold your head up high. Shoot for your goals, and don't let anything stop you. Until the next video, guys, goodbye and lots of love.